There may be hidden obstacles in your life that are preventing you from resisting these pesky little bugs. It's that time of year when we're subjected to increases in stress demands that our body has to adapt to. Holiday treats laden with sugar, artificial sweeteners, refined flour, and bad fats. How about driving in the snow and ice, family situations, finances, etc.? Combination of these can overload the body's ability to adapt, leaving your resistance lowered, resulting in colds and flu. Your resistance to these is the key factor. Bacteria and viruses are in and around us all the time. So why is it that in an office or in a family, some might get sick and others don't? It's not as much about reducing exposure to the bad bugs, it's more about making healthy lifestyle choices that increase our internal ability to resist them. So how can you increase your internal resistance? You can reduce as much as possible or totally eliminate sugar. Sugar decreases the immune system function for hours. Consume high-quality fish oil containing essential omega-3 fatty acids on a daily basis. You want to eat a variety of fruits and vegetables every day to get a balance of vitamins, minerals, and antioxidants. Exercise regularly, preferably 20 to 30 minutes a day. You want to reduce your stress is also a key component. Go to our website, www.chappellhealth.com, and search stress management for several easy techniques. You want to get plenty of rest. Make sure that you're drinking plenty of water as it flushes and detoxifies the body, as well as improving metabolic functions. Other helpful hints include buffered vitamin C. Vitamin D3 has been shown to reduce colds and flu by up to 42%. Use garlic, onions, ginger, and other spices such as oregano and turmeric, as they have antimicrobial properties. And most importantly, get adjusted by your chiropractor regularly. Why chiropractic? It's not just about back pain. A properly functioning spine and nervous system have been shown to keep your immune system functioning at peak performance. Here is an eye-opening quote from the San Francisco Chronicle. History shows that during the flu pandemic of 1918, those under chiropractic care had a far better chance of survival. The ratio of flu cases cared for versus deaths was as follows. Those under medical care, 1 out of 17 died. Those under osteopathic care, 1 out of 36 died. And those under chiropractic care, only 1 out of 866 died, end quote. Furthermore, Ronald Perot from New York University found that patients under long-term chiropractic care had between a 200 and 400% stronger immune system than non-chiropractic patients. If you do feel like you're coming down with something, I have had many practice members experience great success with apple cider vinegar. You can view a 4-minute video I produced as how to use it for colds and upper respiratory problems, again, on our website. You want to put apple cider vinegar in the search box. Another interesting process is using hydrogen peroxide. In 1928, Dr. Richard Simmons, medical doctor, hypothesized that colds and flu viruses entered through the ear canal, not necessarily through the nasopharynx, and German researchers had great success in using hydrogen peroxide in dealing with colds and the flu. It's important to begin treatment as soon as the symptoms appear. If treatment is started promptly, remarkable results curing the cold and flu within 12 to 14 hours are noticed, and the effectiveness is in the 80% range. Hydrogen peroxide to 3% can be purchased in most drugstores for a couple of dollars. You want to lie it on your side, put a few drops of the hydrogen peroxide in the ear, and there will be some little bubbling and in some cases some little minor stinging. You want to wait until that subsides, about 5 to 10 minutes, and then turn over, put a cloth under the ear, the treated ear, to catch the fluid running out, and repeat with the other ear. Also, this method is perfectly safe for infants and children to use. The bubbling sensation may frighten them a little bit, but just provide strong support. Avoid getting hydrogen peroxide in the eyes, and if you do, just flush with some water. And don't do this procedure if the eardrum is not intact or if there have been tubes inserted. Another common problem that I see often with people getting sick is the adrenal glands are depleted. These are your stress hormone glands, and they are master glands that upregulate multiple vital functions in the body, and one of those is the immune system. When I hear people talk about having colds and flus for days on end and just keep dragging on, maybe into weeks, their adrenals are usually depleted, and target-specific supplements can often get them jump-started again, usually within a couple of days. And last but not least, Bacteria and viruses do not survive and thrive well in an alkaline environment. Unfortunately, typical American diet and our stress levels increase acidity in the body, which creates a fertile environment for the bugs to grow in. You can move from an acid to an alkaline system by making simple dietary changes. As to flu shots, they are a whole different conversation by themselves. You can check our website again, click on the Wellness Library, Vaccinations, and then Flu Vaccinations for additional articles. Briefly, the Center for Disease Control says that vaccines are questionable insofar as their efficacy for the general public, other than very high-risk populations. So if you do have to get the flu shot, request a single-dose vial, as multiple dose vials contain mercury as a preservative, and the mercury may have a toxic effect on brain function. As an example of this, the San Francisco Chronicle article mentioned above also has the following quote. The world's leading immunogeneticist Hugh Fudenberg stated that if an individual has 5 consecutive flu shots, his or her chances of getting Alzheimer's is 10 times greater. And adding to the backlash of anti-vaccine comments is that there was an article published in the Journal of Virology in November 2011. It says that the flu shot compromises the immune system and hampers the development of virus-specific T cells. And T cells, T lymphocytes, play a central role in the cell-mediated immunity. The vaccines could actually be making children and other people more susceptible to the flu and other viruses. So good luck in navigating the cold and flu season in a healthy manner. Please check the like button and share this information with family and friends. And remember, you now have the information. You've just got to take action, put it to use, and transform your life today. So thanks for joining me.